Namaste everyone, myself Neha Gupta, student of MBBS first year. Today we are going to study about femoral triangle which is present in the lower limb. Femoral triangle. Femoral triangle is a triangular depression which is present in the front of thigh upper 1/3 region. This diagram shows the femoral triangle. Let us see the boundaries. In the lateral side, it is surrounded by the medial border of sartorius muscle, medially, medial border of adductor longus muscle, base is formed by the inguinal ligament, and apex is where these two muscles cross each other. Let us see the diagram. This is the sartorius muscle and its medial border form the lateral boundary of the femoral triangle. This is the medial border of adductor longus muscle, this is the apex, and this is the base. The roof of femoral triangle is formed by the skin, superficial fascia, and then the deep fascia, also known as cribriform fascia. The floor of the femoral triangle from medial to lateral is adductor longus muscle, pectineus muscle, psoas major tendon, and iliacus muscle. Let us see in the diagram. This is the adductor longus muscle, pectineus muscle, psoas major tendon, and iliacus muscle. This diagram, the floor of the femoral triangle formed by the adductor longus, pectineus, tendon of psoas major, and the iliacus muscle. Let us study about the contents of femoral triangle. The first is the femoral artery. This is the femoral artery, which is a continuation of external iliac artery. It has 6 branches, 3 deep and 3 superficial. The second content is the femoral vein and its tributaries, and it lies medially to the artery. In this diagram, we can see that this is the femoral artery, and this is the femoral vein which is medially to the femoral artery. The next is the femoral sheath, then the nerves, femoral nerve, nerve to pectineus muscle, femoral branch of genitofemoral nerve, lateral cutaneous nerve of thigh. The last content is the deep inguinal lymph node. The femoral artery, femoral vein, and the lymph node are enclosed in the femoral sheath. Here we can see that this is the femoral sheath inside which these 3 contents are situated. The femoral sheath in the anterior wall is formed by the fascia transversalis, and the posterior wall is formed by the fascia iliaca. Femoral sheath has 3 compartments. Towards the lateral side is the compartment for femoral artery, intermediate compartment for the femoral vein, and the medial compartment is for the lymph node. The medial compartment of the femoral sheath is also known as the femoral triangle. In this diagram, this is the femoral canal with lymph node. Let us also study about the femoral artery. We know that it is a continuation of external iliac artery. Its extent, it passes downward and medially. First it enters in the femoral triangle, then adductor canal, and which opens in the adductor magnus, and then this femoral artery becomes the popliteal artery. Femoral artery has 3 superficial branches and 3 deep branches. 3 superficial branches are superficial external pudendal artery, superficial epigastric artery, and superficial circumflex iliac artery. The superficial branches are superficial external pudendal artery, then the superficial circumflex iliac artery, and superficial epigastric artery. The deep branches are profunda femoris, which is the largest branch of femoral artery, deep external pudendal artery, and the muscular branches. Profunda femoris artery, deep external pudendal artery, and the muscular artery. Thanks for watching. Please like and subscribe the channel.